Hello everyone, I'm Sapkota. Human trafficking or trafficking in persons, also referred to as the modern form of slavery, is a global phenomenon. Imagine in 2016 alone, for example, 40 million people from across the globe were trafficked for various forms of exploitation, such as forced labor, marriage, sexual exploitation, or for organs. Every year, thousands of Nepalese women and children are trafficked to India, Middle East, and across the world. Some survivors with experiences of severe abuse and exploitation return to Nepal. And these survivors are often sheltered in non-governmental organizations managed shelter homes. Post-traumatic stress disorder, PTSD, is one of the most commonly reported mental health problems of these survivors. Classic treatments for PTSD, such as trauma-focused CBT, EMDR, although are effective in the short term, these treatments are resource-intensive, lengthy, not easy to learn, and of course, there's a lack of trained therapists in low-income countries like Nepal. Therefore, we opted to test a novel intervention strategy that is brief, easy to learn for the treatment of PTSD among these survivors in Nepal. This intervention strategy is called reconsolidation therapy. So, because reconsolidation therapy is a novel therapy, you must be wondering what it is. Memory reconsolidation theory suggests that a previously consolidated memory temporarily returns to an active state and becomes labile, again when recalled under appropriate conditions. In order for this labile memory to persist in long-term memory, it must be re-encoded, a process known as reconsolidation. Animal and human studies show that beta blocker, propranolol, interferes in this reconsolidation process and weakens the trauma memory. This basic neuroscience finding was translated into clinical research in a proof of concept study by Professor Alain Brunet and his team at the Douglas Research Center in 2008. It has been subsequently replicated in various studies, including RCTs involving participants with PTSD. In this brief treatment, PTSD patients, based on their ideal weight, which is measured according to the height of the patient, take 40 to 80 milligrams of oral propranolol. They wait for 60 minutes after taking this propranolol, and then for 10 to 25 minutes, they write and read their own traumatic experiences. This taking propranolol, waiting for 60 minutes, and writing and reading of their own trauma account is repeated once a week for 5 weeks. Reconsolidation therapy is then complete. We designed a very straightforward clinical trial to test the effectiveness of reconsolidation therapy among the human trafficking survivors in Nepal. The plan was to go to Nepal, collaborate with these NGOs that are sheltering the survivors of human trafficking, and with the health professionals providing healthcare to these survivors. And the plan was to train these health professionals on reconsolidation therapy, then use these trained professionals and support from NGOs to conduct this study. However, because of COVID-19 crisis, we have not been able to complete the study in Nepal, although we have completed the background work, for example, ethics approval, instrument translation, establishing collaboration with stakeholders in Nepal, etc. And considering the current lockdown and social distancing measures in place, it is not possible to conduct an in-person study any soon. Online health has become one of the most convenient way to provide evidence-based treatment, and also the existing literature indicates that properly adapted online treatments can be equally effective as face-to-face treatment. And to do that, we have to adapt the treatment strategy and also make it easy to access to the target population. So now we plan to conduct an online training of the health professionals, support the NGOs to have a regular access to dedicated computer with regular internet service for the period of study. Furthermore, not all the potential participants are educated and or computer literate. We plan to organize an online workshop to educate and support potential participants on the use of the internet and computers. Thank you. Thank you so much for your attention.